Hello, and welcome to a presentation on requirements for emergency management in healthcare. I'm your instructor, Sean McKay. So there are legal aspects of the emergency management. Healthcare facilities have to adhere to all federal, state, and local requirements in the implementation of emergency planning. There are several federal laws that are out there and policies that facilities have to follow. And then, of course, each state and local locality have their own requirements that a facility must meet. The Emergency Management Assistance Compact basically is a congressionally authorized interstate mutual aid compact that provides a mechanism through which states can provide assistance. EMAC addresses reimbursement, liability, and compensation and licensure issues. Of course, we have the Federal Employee Compensation Act, which provides workman's compensation for employees that are injured or killed during the course of their duties. We have the National Emergencies Act, allows the president to declare a national emergency, and then which triggers emergency authorities that are contained in the federal statutes. Basically, it doesn't have an authority to set rules, but it relies on the emergency authorities in other statutes, such as the Public Health Service Act. Of course, we've got the Pandemic and All Hazards Preparedness Act, and it addresses the organization of public health emergency preparedness and allows us to respond to large scale events that are dealing with, you know, either small localities or across the entire United States. Of course, we've got the Public Health Service Act, and authorizes the HHS secretary to determine that a public health emergency exists, which triggers emergency operation plans to permit the federal government to assist state and local governments. So that allows us to change the requirements for response to uh, care of patients, reimbursement of patients for monies and things like that, and dealing with the funds for public health emergencies. Public Readiness Emergency Preparedness Act, and authorizes the HHS Secretary to issue a declaration that provides immunity from tort liability for claims of loss caused by countermeasures. So basically, this are things that we deal with, such as vaccinations and things like that, and other measures that we may take to counteract things that are acting across our United States. We have the Stafford Act, which authorized the delivery of federal emergency technical, financial, logistical, and other assistance to states and localities. This is where we get our FEMA funds from. And of course, the governor has to determine that we have an emergency, and then they have to declare an emergency. This is not just saying, "Hey, I need to do it." They have to look at what's going on, and then they have to say, "I have an emergency. I kind of fits the need that I need extra funds and I need extra response by the federal government." And then they have to declare a major disaster or emergency of an area. And then we got the Social Security Act, which authorizes the HSS Secretary to temporarily waive or modify certain Medicare and Medicaid, children's health insurance programs, and HIPAA requirements for facilities. These are things that are dealing with billing and treatment of patients in certain manners. Maybe that they no longer have to seek authorizations, or they're allowed to do certain things based on what's going on across the United States or during that emergency. We've got the Volunteer Protection Act, which provides immunity for ordinary negligence to volunteers of nonprofit organizations or government entities. Again, it doesn't cover gross negligence or willful misconduct or recklessness of acts committed by that volunteer. and does not require a declare of emergency for its protection to apply. Homeland Security policy directives and the presidential policy directives. The presidential directives announce executive policies regarding, among other things, homeland security issues. And they establish policies, strategies, and frameworks directing executive or agency activities on a range of homeland security matters. This may be regards to response and recovery and to things such as FEMA teams and DMAT teams, DMORT teams, and different events that are happening across the United States depending on the emergency that's going on. The National Incident Management System, again, is a system incident command developed by the Department of Homeland Security to deal with all levels of events across the United States, all the way from the federal government all the way down to your local responder. It's scalable and, again, can be used from the local response to a car accident all the way up to a full-blown disaster. The National Response Framework, it's a policy document that uses a national and all hazards approach to integrate our roles in the government at all levels and our private sector. And remember, in many cases, the private sector helps us, and of course, with non governmental organizations such as Red Cross and things like that, they're all part of that national response framework. And of course, it uses NIMS to coordinate response activities. The national strategy documents, which are federal legislation and directives mandated the creation of various strategies and plans to chart our national emergency planning and response activities. They're intended to be part of the framework and address how we coordinate and our state and local and our responses to events, including the government and private organizations. Centers for Medicare and Medicaid Services applies to all 17 provider and supplier types. Its implementation date of November 15th, and compliance required of all for participation. Anybody that participates in Medicare. And this is basically called the final rule. And it basically sets out the requirements that we need to be prepared for emergencies. And it delineates certain things that need to be in the plan and what we need to address as part of the plan to emergencies for facilities. If you participate in Medicare or Medicaid, you are required to follow these rules. Again, some of the things that are part of it are based on the hospital emergency operations condition of participation, and it deals with safeguarding human resources, maintaining business continuity, and protecting physical resources. So 4 provisions for all provider types. We need a risk assessment. We need policies and procedures, communication plan, training, and testing. So these are the things that need to be part of your emergency preparedness program. We have to have a risk assessment and planning. So we need to develop an emergency plan based on our risk assessment. That risk assessment has to be using an all hazards approach, focusing on our capacities and capabilities. And it must be updated at least annually. It should be updated more often, but at annual basis, it should be updated. What's our all hazards approach? All hazards approach basically integrates our preparedness and our planning and looks at all the capacities and capabilities that our facility can do to respond to events, no matter how small or how large, whether they're man-made or they're natural. And they're specific for your location. You know, what you plan on for an all hazards approach may not work for the same facilities across the other side of the county, because they have different aspects of hazards that you have. So policies and procedures. We want to develop and implement our policies and procedures based on our emergency operations plan and our risk assessment. We got to address our range of issues, including subsistence needs, our evacuation plans, and procedures for sheltering in place, tracking patients and staffing during an emergency. And this is only among some of the things that we need to deal with. We need to do response. We need to deal with supply chains. We need to deal with security and so much more. And we got to review and update these policies and procedures at least annually. Communications plan. We've got to have a communications plan. Without communications, you're going to fail. You need to communicate up and down, left and right, inside and outside. You have to have some type of plan that tells you how you're going to do this. You're going to have a plan of things fail, phone systems fails, radio systems fail, phones fail. What are you going to do? Are you going to have runners? Are you going to have paper? What are you going to do? Again, we're going to review and update this plan annually. Temperature controls. This is part of our plan. We need to deal with our temperature plan. What are we going to do if our heating goes out? What are we going to do if our HVAC system goes out? What are we going to do if the air conditioning goes out? We need to have a plan for emergency power and standby systems. Training and testing. Okay, the CMS emphasizes the following that we need to have. We need to develop and maintain training and testing programs. You just can't train somebody and say you're trained. You have to test that program through evaluation. They got to demonstrate the knowledge of the emergency procedures and evacuation procedures and location and patient instructions. Just because you say that they read a piece of paper doesn't mean that they know how to do it. And then we got to have drills, and those are prescribed by law, whether locally, federally, or tribally, and or other organization that oversees our facility. All new staff have to have initial requirements of testing, and then they should have ongoing testing as a biannual training of the staff. And of course, this deals with inpatient procedures and supplies. And it should also include administrators. And we should administer at least 2 preparedness drills per year. And we also have that outpatient providers must test for emergency preparedness once rather than twice a year. JCAHO, which accredits over 20,000 healthcare organizations and programs in the country, and is commonly referred to as the Joint Commission in the healthcare facilities. Sets standards for healthcare organizations and issues accreditation. And that allows us to periodically, JCAHO conducts on-site surveys to make sure that you're meeting the requirements for the accreditation. JCAHO requires the healthcare organization to develop and maintain written emergency management plans. Again, we want to have an emergency operations plan or emergency management plan to deal with our facility and what we deal with on a day-to-day basis and dealing with emergencies. They are required to develop and maintain an emergency management plan so that the patient care can be continued effectively in the event of emergency or disaster situations. Again, remember that events happened, but the rest of your healthcare facility continues. So you need to have plans in place to deal with the emergency and the continued operations of your facility. Again, each state, tribal, and local government may have requirements for your facility for emergency management requirements also. And that's the last of this particular discussion. If you have any questions, please don't hesitate to see me in class.